Welcome back, beautiful tri-state area. You're listening to A Moment of Zen right here on 710 WOR, the voice of New York, iHeartRadio. I'm your host, Zen Sams. Up next in our Going Deep segment, we're featuring Dr. Babak Maleki. He's an acclaimed ophthalmologist and oculoplastic surgeon, board certified and recognized for his proficiency in cosmetic and reconstructive eyelid surgery. With a professional record of performing over 10,000 eyelid surgeries in the past decade, Dr. Maleki's practice encompasses procedures like blepharoplasty, ptosis repair, and brow lifts. As an educator, he has mentored many medical residents and students across various specialties. He continues his educational endeavors as a faculty member at the University of Toronto. Internationally, he contributes his skills through Orbis. They provide aid to underserved global communities. Today, we're chatting cosmetic procedures and surgeries surrounding the eye area. Welcoming now to the show is the amazing Dr. Maleki. Welcome, superstar.
Thanks for having me, Zen.
So excited to chat with you.
Excited to be here.
Okay, so let's chat cosmetic eyelid surgery. So eyelid lift, brow lift, this is your area of expertise. Eyelid lifts, known as blepharoplasty, and brow lifts are rising in popularity, and these procedures are increasingly being used instead of fillers to maintain a youthful and natural appearance. Of course, we know that they offer rejuvenation without hindering current facial features and allowing for more natural movement. With such an extensive background in oculoplastic surgery, what initially drew you to specialize in cosmetic and reconstructive eyelid surgery?
My story, my background is, as you mentioned, I'm an ophthalmologist. So I did extensive training in surgery around the eyes. And then I did a advanced training, fellowship training in oculoplastics, which is surgery of the eyelids, brows, lower lids, mid-face, cheek area. So basically everything around the eyes. And the reason I got interested in it is because I was really impacted by both the functional and the aesthetic impacts of these types of procedures. For example, when I was doing these types of surgeries during my residency, I could see that this was having a huge impact over people's function. For example, if somebody has a ptosis, so ptosis is when the upper lid is drooping down and blocking, could be, if it's severe enough, it could be blocking the pupil. That had a huge impact on people's vision. So doing a ptosis repair has a huge functional benefit because it opens up the eyes. It also has a huge aesthetic implication because it makes people look less tired, less sleepy. So I really like this combination of functional and aesthetic procedures. And in terms of what if you think about what makes the most impact in people's lives, or if you look at the face, I mean, the eye area is hugely significant. Like there's some good studies that show that eye tracking, that we spend about 80 to 90% of our time looking at people's eyes when we're looking at their faces. So just from an aesthetic point of view, having an impact on your eye area is hugely impactful. In fact, blepharoplasty is one of the most common cosmetic procedures in general. It's because it impacts so many people. So I thought huge impact, wide reach, has both functional and aesthetic implications. I was really excited about it. So that's why I decided to do oculoplastics as a specialty.
Seems like you did it for all the right reasons. Now, blepharoplasty obviously is it's basic, right? The basic of it. Now, who might be a good candidate for the basic procedure?
Blepharoplasty, you can divide it into upper blepharoplasty, which is the upper eyelids, and then lower blepharoplasty, which is the lower eyelids. So upper blepharoplasty, good candidates for people who have a lot of excess skin or a lot of excess fatty tissue in the upper lids, which makes the upper lid very, very heavy and droopy. A good candidate for lower lid blepharoplasty is people who have eye bags, under eye hollows, dark circles, wrinkles under the eyes. So those are good candidates for lower lid blepharoplasty. Oftentimes we do them in combination, upper and lower together, but not everybody needs an upper and a lower. Some people are just upper lid candidates. Other people are just lower lid candidates. And so, but the main distinction feature is the excess skin, excess fat, and then in the under eye area, hollows. We are seeing a lot of patients coming in who have under eye hollows and dark circles, and they're looking for more natural and more approaches to their treatments. Fillers has been something that people have been doing for quite a while, but now there's a shift moving away from dermal fillers towards surgery because of people are looking for something that's a bit more long lasting, first of all,
And
and
natural looking.
more natural. Yeah, and
Now,
there's lots of issues with fillers that we can get into, but and I'm sure your viewers would like to know about them because they're so popular. Fillers have been so popular over the last decade or so.
yes, there's some ups and downs on that topic. Now let's chat fox eye, cat eye surgery. So this trend, known as a temporal brow lift, has gained attention for creating a lifted and elongated eye shape, influenced particularly by celebrities and social media. It promises a very youthful and exotic look. However, it faces criticism for cultural insensitivity and concerns about long-term appeal and potential complications. What do you say to this?
Yeah, so you're absolutely right. The fox eye or cat eye trend was first popularized in Eastern Europe and Russia, where they were doing thread lifting. So they were doing thread lifting to the outer portion of the brow, and it brought the brow to a very unnatural kind of position. And so yeah, there has been some backlash in terms of why are people offering this in the first place. The basic principle of it, there's some logic to it. So if you look at the aesthetically appearing eyes, or people who have nice eyes or aesthetic shapes, the outer corner of the eyes is generally higher than the inner corner. So that is true that having a slightly, and this is called having a positive canthal tilt. So the canthal tilt is basically, if you take a straight line from the inside corner of your eye to the outside corner, that's the kind of the canthal tilt. You can either have a positive canthal tilt, meaning the outside is higher, or you can have a neutral canthal tilt, or you can have a negative canthal tilt, meaning the outside is lower. And there are ethnic differences between these. So certain ethnic groups tend to have more of a positive canthal tilt, others tend to have a more neutral, and some ethnicities have a more negative canthal tilt. So changing the tilt of the outer corner of the eye does change the ethnic appearance of that person in a certain way. So you have to be sensitive about that, and you have to know what you're getting into before. But what's happened with this fox eye trend is that it went to an extreme. Like, people go into this extreme positive canthal tilt where the outer corner is really, really pulled up. It looks very unnatural, and there's kind of been a return to looking more natural now. So people are, I think that trend is fading away, and I think it's less popular now. But it was gaining popularity a few years ago, for sure.
For sure, yes, and there's trends, right? Everything trends and it comes and goes, but this fox eye, cat eye still kind of is lingering in the background, and people are starting to really kind of question the authenticity of why somebody would want to do it unless it really had a lot of medical, benefits to it. Now, aging comes with facial changes, including hollows, like you said, and sagging skin and wrinkles. Excess skin has been thought to be the hallmark of facial aging for many years. Today, excess skin is seen as a symptom of facial fat loss. Now, facial fat transfer is designed to inject fat back into the affected areas to help restore the facial volume and support the areas of the face that make it look youthful. What is your recommendation?
Yeah, you're right. So our knowledge of facial aging has changed tremendously over the years, and you're right. Traditionally, when people were looking at doing facelifts, they're looking at stretching the skin in this direction, and that was the only way of rejuvenating the face. But the thing is that as we age, there are three things that are happening. You are definitely getting descent of the face, so things start to droop down. So the brows tend to come down, so you get a lateral brow droop. You can get a mid-face or lateral cheek droop. Nasolabial folds come down. So there's a downward descent to the facial structure. So muscles and tendons tend to come out. But you're also losing volume too in the face. So a lot of important facial fat pads, medial cheek fat pad, temples, lips start to lose volume. That's an important part of the aging process. And the third part, which is super important, is the skin. The skin is also aging. It's getting thinner and it's becoming more wrinkled. So if you think about rejuvenating somebody's face, you want to address all three components of the aging process. So if somebody's face is drooping down, you may want to consider doing a lateral brow lift, a cheek lift, a lower face and neck lift to reposition the tissues. But usually what we're doing is we're trying to, in the more modern techniques, are going in deeper structures to lift the deeper structure up So you don't get this pulling effect. So you're repositioning tissues, and so they're going back to their normal anatomical position. But then you also want to add volume. Now this is an important part. So volume, you can use dermal fillers to revolumize the face, but some areas of the face are trickier than others to revolumize. And the area that's getting a lot of attention in recent months and years is the tear trough mid-face area. A lot of people are coming with puffy cheeks, swollen cheeks, so something we call malar edema. And I see this in my practice on a weekly basis. People coming in, having had dermal fillers in the cheek area, tear trough area, and they come in with these swollen cheeks and swollen under eyes, and it looks very unnatural. And if you go to my page, you'll see tons of patients who've had these types of procedures elsewhere. And then what we have to do is we have to remove that filler process by dissolving it and sometimes tightening the tissues. And then we still haven't addressed the first problem, which is the loss of volume. This is when the fat grafting is super useful. So fat grafting, what it is you're taking fat from one part of your body, typically would use from the abdomen or from around the belly button or the thigh, areas that we have storage of excess fat, and then we inject it back in the face. Now, fat grafting is not a new phenomenon. It's been around for years. Some of the problems that we were having with fat grafting initially is they were just taking fat from one area and just injecting it back into the face in another area without processing that fat. So the fat, you can imagine the fat on your belly is very different than the fat on your face. The fat on your belly is much more lobulous.
Right.
So people were getting lumps and bumps in the face. So then that kind of scared a lot of people off from fat grafting because they were having these problems with the transfer. So now the modern fat grafting techniques, what we're doing now is we're taking the fat and then we're filtering the fat through a process where we're using this filtering system where we're getting smaller and smaller fat molecules. And then the fat molecules that we're getting look very much like fillers. So we can be very specific and targeted and revolving.
It's fascinating.
Yeah, so now we're doing what's called nano fat transfer for the tear trough, which is really small particles, micro fat for the midface. So now the fat grafting is totally changed. Now it's smooth.
Yeah, without a doubt, this technique, fat grafting, that we're talking about has become increasingly popular. Of course, we were just talking about for the natural looking and long lasting results compared to synthetic fillers or implants. And of course, it involves transferring fat from one body part to the face, restoring volume and improving facial contours. It's considered less invasive than traditional facial surgery, and of course, offers long lasting, natural looking results with minimal downtime. Now, let's move on to ptosis or drooping eye. We touched upon this a bit earlier in the questions. So ptosis or drooping eye repair is a specialized procedure. Can you tell us more about what it involves and the impact it can have on a patient's vision and appearance?
Yeah, for sure. Yeah, as you said, ptosis is a very specialized area. In fact, most general plastic surgeons don't do ptosis repair. Even most facial plastic surgeons don't do ptosis. So it's really a procedure that's done best by an oculoplastic surgeon, so a plastic surgeon who specializes in surgery around the eyes. And the reason is because it's the nature of the way we do the surgery. So basically what we do is in ptosis repair, we're finding the muscle that has become weak or had slipped, and we're either reattaching the muscle to its original insertion or we're strengthening it. And we're talking about adjusting the lid position by like millimeters, 1 millimeter, 2 millimeters, highly delicate, highly specialized area. And if you think about it, we also have to balance the two eyes, right? So if one person has like a 1 or 2 millimeter ptosis on one side, it's very tricky to lift that one up by a millimeter or two and then make sure that it's balanced on the other side. There's many different techniques for ptosis repair. I have some specialized techniques that I use, whether we're doing with blepharoplasty or without blepharoplasty. Blepharoplasty is if we remove skin or fat in the upper lids. So sometimes we have to do that. Sometimes we don't have to do it. Sometimes it's just a muscle repair. But yeah, it has a huge impact on patients' self-esteem. If the ptosis is bad enough, it can have a huge impact on their vision. So it's one of my favorite procedures to do, to be quite honest with you. But it is a very tricky one and a very finicky one, and definitely something that requires high level of expertise and practice.
which brings me to I want to cover innovation and adoption. So, without a doubt, I've been particularly myself using a product called CO2 Lift. I'm going to touch on this just a little bit. It's game changer in a lot of pre and post surgery, increasing the presence of wound repair factors and growth factors, help cells turn over faster, reducing the appearance of aging and scars and stretch marks, and just so much more. Particularly when you're using it on the face, it stimulates collagen and elastin production, which promotes elasticity and helps retain hydration. Now, I know that in your practice, you have incorporated carbon dioxide therapy, particularly in procedures like blepharoplasty or ptosis repair and brow lifts. Can you speak to me more about this?
Yeah. So the way it came about is that as part of the blepharoplasty surgery, I also do a lot of CO2 laser resurfacing. So CO2 is like my mainstay for tightening the skin around the eyes, so wrinkles, fine lines, and it does an amazing job at that. However, one of the downsides of this particular laser is that there could be a prolonged healing time where the skin is a bit red and swollen, and sometimes it can be red and swollen up to 2 weeks after your procedure. So, so I came across the CO2 lift or the carboxy in an effort to. I was researching at ways of decreasing my recovery time for my patients, because everybody wants to recover quicker. They want to go back to work. They want to go back to and I started using that post lower blepharoplasty with laser resurfacing, and I had some amazing feedback from my patients, but also I was able to observe it myself when they were coming back for their follow-ups at the 1 week point. There was less redness, less swelling, and the recovery was a lot quicker. So, so that's been a game changer in terms of speeding up the healing process. And I think it could be applied to any procedure. But in my practice, what I found the most benefit is in terms of lower blepharoplasty with CO2 laser resurfacing, particularly because of the fact that we're covering a large area, and and it really can help speed up the recovery process by stimulating collagen production, by decreasing some of the inflammation, and it makes a huge difference. So I've been quite. I was quite pleasantly surprised when I came across this, and since using it, I've been quite happy with it so far.
Yes, the feedback seems to be amazing. I myself have used it post surgery on skin tag removal. I'm also going to be using it on an explant procedure I'm having with Dr. Rankin. I'm explanting my breast implants, and I think I will be the first in his practice to try this post surgery. I'm just going to opt for a natural lift, but yeah, I've been doing my research as well and advocating for carbon dioxide therapy now for the last couple of months, and been using it to make sure that this is exactly what they say it is. And boy, the results are phenomenal. Even for diabetic ulcers, I gave it to a family member. It was great. Now let's chat the future of ophthalmological surgery. So how do you envision the role of innovative therapies like, for instance, CO2 lift, carbon dioxide therapy, and others evolving in the future of ophthalmological surgery?
Yeah, the way I see things evolving, it's beautiful. It's quite amazing. There's really what I see happening is a combination therapy happening. People having traditionally, if you think about plastic surgery, ophthalmology, you've had surgeons doing their surgical procedures, and then you've had dermatologists, nurses, other people doing their non-surgical things. And really, what's happening now is like it's a marriage of what I'm seeing is that laser procedures in combination with surgery, in combination with post-procedure care, really is enhancing the results of surgery. People are looking more natural. The recovery is a lot quicker, less pain, less discomfort, and that's where I see the beauty of people who are at the cutting edge of this of science and what's going on, is that being able to utilize all these different features, and you have to have an open mind to it. You can't have that traditional approach that, oh, I'm just going to do one thing. No, you have to really have the approach where, well, I want to do what's in the best interest of my patients, and what's in the best of my patients is to offer all of these things in combination. Because when I do them in combination, when I do a lower lid blepharoplasty with laser resurfacing, with fat transfer, and then post procedure, I'm using CO2 lift to reduce the recovery. Their skin is better. Their under eyes are looking smoother, a more smooth transition, longer lasting results, and patients are generally more satisfied. So that's where I see the kind of the future of cosmetic surgery in general going, is that more and more surgeons are going to be, and more practitioners are going to be using multiple modalities, energy-based, lasers. We didn't talk about Morpheus today, but Morpheus is another one, along with fat transfer and then laser and then post-procedure shortening regimens to kind of help with the recovery process. I think that's quite exciting, and I'm excited to see what's going to happen in the next few years.
Well, you're definitely of the younger wave of surgeons who is super educated and very well researched and clinically studied and clinically proven is extremely important to your practice. And that's the difference between the new wave of surgeons coming that are now hosting the generations like the millennials that you're operating on, or even the baby boomers for that matter. But it makes a big difference for the patients to know that their surgeons are at the cutting edge of that technology versus some of the older school mentality surgeons that we know and that are still exist in the industry, that you just can't teach an old dog new tricks. So thank you so much for being at the forefront of all of this. Now, we have about a minute left, and I want to talk about your work with Orbis. It's quite admirable. Can you share an experience that was particularly impactful for you during your time providing aid internationally?
Yeah, no, I did a stint when I was at I went to Niger, Africa, and we were doing some work, and that's really humbling when you go to a place where even the basic infrastructure was lacking, right? So we come in with all our knowledge and all our skill set. We forget that we're highly dependent on tools, right? So when you go to a place like that and you're looking for basic tools and they don't have it, you have to be innovative. Okay, well, if we don't have, they don't have lasers, they don't have all these, these fancy instruments. What can we use? And that to me was the most humbling part of that experience. Trying to help people with what they can. And in the end, I remember we ended up donating a bunch of our tools to the local doctors there because we thought, what, you need basic supplies to be able to, I can transfer as much knowledge as I want to another surgeon, because one of the main missions of Orbis is to teach other surgeons techniques and surgery so then they can be professional. But I was doing the best I can to kind of teach other surgeons, but then if you don't have the tools, how are you going to do the work, right? And that's a major. So it kind of made me. Well, it was humbling, but B, I thought, what, we should probably. I would love to do a bit more fundraising work to raise some money so we can actually provide the tools for these people. And I think that's what's lacking right now. And I'd love to be involved in that effort too.
Well, we are definitely going to have you back on. Now we are officially out of time. I wanted to thank you for coming on. You're a plethora of knowledge, and thank you for just being so insightful and transparent about the procedures, the latest techniques, the innovations. Thank you for bringing us the latest for our listeners and viewers. You were incredible.
Thanks so much. Thanks for having me.
That was our Going Deep segment, brought to you by CO2 Lift. That was Dr. Babak Maleki. He's an acclaimed ophthalmologist and oculoplastic surgeon, of course, board certified and recognized for his proficiency in cosmetic and reconstructive eyelid surgery. You could head directly to their website at torontoeyelidsurgery.com or check them out on the gram at Dr. Babak Maleki, BABAK MALEKI. You're listening to A Moment of Zen right here on 710 WOR, the voice of New York, iHeartRadio. We'll be right back after this.
A Moment of Zen is brought to you by CO2 Lift. As we age, our skin loses moisture and elasticity, causing wrinkled skin. You can reverse this aging process with CO2 Lift. CO2 Lift utilizes the powerful benefits of carbon dioxide to lift, tighten, and regenerate your skin. This simple, painless at-home carboxytherapy treatment is scientifically proven to reverse the aging process. You will see reduction in wrinkles, increase in luminosity, and improve pigmentation, sagging, skin tone, and radiance. For more information or to order CO2 Lift, go to co2lift.com.